Hi there, and thanks for joining. My name is Barb Foster, Senior Manager of Clinical Education here at Med-El. Let's get started. For this webinar, I'll be reviewing how Med-El has you, your candidates, and recipients covered. First, I'll outline the unique intact skin solutions for persons with almost any hearing loss. Next, we'll review a new tool allowing us to see inside each unique cochlea like never before to match the cochlear implant array to that person's unique cochlear length. And then finally, we'll wrap up reviewing all of the support resources which are easy to access for you, your candidates, or recipients. And that saves you time. Our most recent CI offering is the Synchrony 2 cochlear implant system, and that includes the newest internal and external audio processors and accessories. And this is what a CI candidate would receive if they were to be implanted today, which includes the Sonnet 2 and Rondo 3 audio processors and accessories. Let's review some candidacy. Traditional CI candidacy criteria consists of 70 dB pure tone average for adults and profound sensorineural hearing loss for pediatrics. And that's the audiogram you see on the left. 6 years ago, Med-El's electric acoustic system, or EAS, was launched in the United States. This widened traditional CI candidacy to include patients with stable sensorineural hearing loss thresholds within the shaded area you see on the middle audiogram, and single syllable word scores less than or equal to 60% in the best aided condition. This system provides acoustic amplification for the low frequencies and electric stimulation for the high frequencies. And we've even seen long-term hearing preservation results with our implants on patients who fall into this category, something no other implant manufacturer can match. Most recently, in 2019, Med-El received new and groundbreaking FDA approval for implanting persons 5 years of age and older who have single-sided deafness or asymmetric hearing loss. Med-El is the only implant company that has this distinctive approval. So as you can see, with our CI candidacy, we really have all of the audiogram covered. Moving to our bone conduction solutions, we have a couple of options. Adhere is a simple, easy to use, easy to dispense, non-surgical bone conduction device. It's comfortable to wear without pressure on the skin, and it stays in the reliable position, which is optimal for consistent access to sound. Adhere users have the breathing room then to make surgical decisions if or when the time is right for them. With the Adhere device, we're looking at candidates that have bone conduction thresholds in the range of -10 to 25 dB. In addition, Adhere is approved for candidates with single-sided deafness. Bone Bridge, our implantable bone conduction implant, has been used worldwide for over a decade. We can offer this hearing solution to patients in the US that are 12 years of age and older, and allows for all-day wearing comfort with completely intact skin and access to MRI without the need for surgery. There are two primary groups that are candidates for Bone Bridge, those with conductive or mixed hearing loss and those with SSD. In the case of a conductive or mixed hearing loss, their bone conduction threshold should fall somewhere between -10 and 45 dB. And air conduction thresholds, however, can really extend to the bottom of the audiogram. Stable thresholds are important, and the CT scan must determine that the anatomy is compatible with good device placement, and there must be an absence of retrocochlear or central auditory disorders. With the bone bridge device in the single-sided deafness condition, we're looking at candidates whose contralateral ear should have air conduction thresholds within normal limits and the affected ear greater than 70 dB. So when you combine the audiograms for both our bone conduction options, the Adhere and the bone bridge device, as you can see, it covers most of the audiogram. So this allows us to provide bone conduction solutions that fit a wide range of hearing loss to bring more options to many patients. So we have the audiogram covered here too. Med-El strives to provide a solution for every hearing implant candidate. As we just discussed, we have a variety of hearing solutions that cover the audiogram. Not only do we cover the audiogram, but in cases of cochlear implants, we cover each unique cochlea. Did you know that no two cochlea are the same? even in the same person? And I really love this image because it really shows that. And we think that electrode arrays should address specific needs of each unique cochlea. Whether that's normal anatomy, malformations, or ossification, Medela electrodes provide a solution for all shapes and sizes of cochlea, which could lead to a more natural sound quality for your recipients. Unlike other devices, Medel's philosophy all along has been to offer multiple electrode lengths u- to fit unique cochlea. Think of this as finding the perfect fit in a pair of shoes. We all wear different sizes of shoes because we all have different size feet, and one size does not fit all. Like finding the right shoe size, we want to find the right fit for each cochlea. And finding that right fit includes stimulating the apical region of the cochlea for the best opportunity for that place to pitch match. And that means putting the low pitches into the region of the cochlea that it was designed to hear them naturally. With the new Au.D technology just introduced this year, we now have a tool that lets us see into each unique cochlea. And to make it even easier, the surgeon doesn't need to have the Au.D software. We offer Au.D on demand as a free service to clinics. Our team of experts will provide precise measurements for each of our electrode variants based on the pre-op imaging we receive from the clinic, either a CT or an MRI scan. Then we'll send you the precise measurements via a secure platform for how each of our electrodes that fit into that unique person's cochlea. Then your clinic will choose the best fit. Getting the best fit from the beginning is the best place to start. The next step would be to further customize the individual experience by importing a post-op CT scan from Au.D into the Maestro fitting software for fine-tuning via anatomy-based fitting. So what is anatomy-based fitting? Basically, it allows you to visualize exactly where each electrode sits inside the cochlea after surgery. And it's easy to implement with just a few clicks in the Maestro fitting software. So I'd like to think of using Otoplan as finding the right shoe size and then anatomy-based fitting on tying your shoes just right, not too loose and not too tight. And that really allows for overall comfort. So another innovation in Medel technology, it allows our recipients to achieve the best possible outcome with their cochlear implant. So getting the length of the cochlea is important, but stimulating it like nature intended is important too. Only Medel's sound coding strategies have changed and continued to advance over the last decade to include fine structure aspects along with envelope aspects of sound. Now, these strategies are referred to as what we call fine hearing, and only Medel stimulates the cochlea at different rates depending on the incoming sound. And this is engineered to respond just like the natural ear. So I'm going to play a short video here that describes elements of sound.
A sound can be split into two principal components, the envelope and the fine structure. These two parts play fundamentally different roles in the perception of music and speech. Consider the following combination of two speech sounds. This sound
Kathy has 7 dark spoons.
is the fine structure of one sound, and this sound
Peter gives 4 large tables.
is the envelope of another sound. When combined, they make this sound.
Peter gives 4 large tables.
Notice how the envelope is more prominent than the fine structure.
Peter gives 4 large tables.
Now, listen to the following combination of two musical sounds. The fine structure of one sound and the envelope of another sound. Are combined to make this composite sound. With music, the fine structure becomes more prominent than the envelope.
So, as you just saw and heard, both elements of sound are important for listening, envelope and fine structure. It really just depends on what you're listening to. And our recipients, we know, not only want to hear speech with envelope cues, but they also want to hear complex sounds that rely on fine structure. And that is including things like music, listening and noise, and tonal languages. According to a research study, it's estimated that about 70% of the world's languages are tonal, and about half the global population speaks a tonal language. And in the past, research highlighted the limitations of cochlear implant technology in providing spectral and temporal cues necessary for listeners to perceive and discriminate tones. But more research more recent research studies demonstrate that children learning to listen and speak using cochlear implants can develop good tone perception and production. And so listening to tones is also important for other complex signals like music and hearing and noise. And adults can experience improvements in tone perception over the first 12 months of implant use. And only MED-EL has FDA proven benefits for music appreciation. To encourage progress, it's recommended for persons to use a fine structure processing strategy and to practice listening. MED-EL has several music resources available, including courses by music experts on the MED-EL Academy and a recently updated musical ears tool. That resource provides support and guidance for those who would like to engage children in music activities, and it includes an introduction video demonstrating all of the activities in a downloadable PDF booklet. And we also have specially curated free playlists designed for CI recipients, but available for anyone on Spotify, including music for the holidays. Our audio processors are available in multiple wearing options, customizable to suit any style, comfort, or active lifestyle choice. With an IP rating of 6.8, our latest all-in-one processor, the Rondo 3, is resistant enough to the elements to endure really most any daily environmental situations, including dust, sweat, splashes, and more. In fact, it can survive a submersion in water up to a maximum depth of 1 meter for 60 minutes. So this means that small children wearing a cochlear implant audio processor are not missing out on language learning during bath time. For any extended use beyond these indications or for water sports, we would recommend using waterwear accessories. The Rondo 3 is the easiest to use processor, I think. There's only one mic cover to change every 3 months and wireless charging for all day hearing. So there's no batteries to change, and I think it can promote independence with processor use, whether you might have an older adult with limited dexterity or a child learning to be more responsible for their audio processor. Our audio processors also include features like streaming options and a mobile app that can be used as an optional remote control with handy features like Find My Processor, data logging, or Guardian control. And that's so parents or caregivers or even teachers can oversee daily functions of pediatric processor use. The Android smartphone with Android 12 operating system and newer includes a new algorithm called combined audio device routing, and that supports simultaneous streaming for audio to more than one device. So this means that with this new capability, a growing number of Android smartphones will allow for bimodal streaming with the combination of a hearing aid that's equipped with ASHA or audio streaming for hearing aids technology and a MED-EL audio stream, making bimodal streaming easier than ever. Now, our Maestro software is easy to use and includes highlighted areas to guide you through the next steps in the fitting process. Fitting anyone, including children, can be a quick process when you use features like interpolation and progressive maps just to start. And thresholds are locked to 8% of MCL by default. So using objective measures can also help corroborate your fitting in the software. One of my favorite things about our most recent version of Maestro software is the system check tool. And this can be used to determine if both microphones of an audio processor are working properly. And this saves you the step of a manual mic check. Since it's right in the software, you can see the status indicators for battery level and battery health for the Rondo 3 audio processor, so you know how much battery life is left. So that was a very brief overview of our latest software and processor features. But what I want you to take away from this talk is that audio processors and accessories are changing faster than ever in our industry, almost every year or two, just like other technology like cell phones or computers. Processors and features will continue to evolve at a pretty quick rate, but one of the most important goals of Medell has really always been to ensure that we provide our recipients with a lifelong commitment of backwards compatibility. Medell has over 25 years of legacy support with our recipients, and that continues with the Sonnet 2 and Rondo 3 audio processors, which are 100% backwards compatible for your recipients. That means all of our recipients back to 1994 have the ability to benefit from our latest audio processors at the time of availability. And what's on the most important thing we think is what's on the inside, since we know those processors will change over time. And Medell is so confident in our internal technology, we introduced a global MRI guarantee. And our recipient should have peace of mind knowing that their implant will be safe during an MRI scan. Medell guarantees that we will replace the implant in the very unlikely event it's damaged in an MRI scan that is conducted according to the instructions. This guarantee is applicable to all of our cochlear implants and bone conduction implants that date back to 1994. So that means every one of your patients, even if they have a legacy device, and even if their original 10-year manufacturer's warranty covering other aspects of the implant has already expired, they are now automatically covered for the rest of their lives with this global MRI guarantee. And I think that gives you and your recipients peace of mind. Pictured here are our co-founders and creators of the world's first multi-channel cochlear implant, Dr. Ingeborg Hockmeyer and Professor Erwin Hockmeyer. We manufacture all of our implants at our headquarters in Innsbruck, Austria, for the highest reliability. Inga remains our CEO, and to us, reliability and safety are not percentages on earnings report for investors. We are committed to our customers, not shareholders. Now that we've reviewed how Medell covers the audiogram, offering benefits for almost any hearing loss, and we've talked about the importance of the reliable internal device covering the full length of the cochlea for each unique CI recipient, we'll now talk about how we cover your support needs. Our partner care program has something for everyone. We have support in place for potential recipients, newly activated recipients, long-term recipients, the here peer community, as well as speaking and bilingual recipients. So Medell's mission is to overcome hearing loss as a barrier to communication and quality of life. As a company, Medell truly values feedback from recipients and clinicians alike. We understand the challenges of a busy clinic and work with intention to implement a program where we could partner with audiologists to support Medell recipients. So we have a relatively new program called Medell Mondays, and we offer Zoom courses every Monday. And one of our most popular is called After Activation Basics. So we review kit contents, basic processor care, processor function and operation, and additional support resources available as well. This course is a great resource to review information likely discussed at the activation or maybe didn't have time to get discussed at the activation. And there's no limit to the number of times a recipient or family member can attend. And we offer courses for both cochlear implants and bone bridge recipients too. Simply navigate to medellevents.com or use the QR code you can see on the screen here to access several of these resources. So some patients are referred to these appointments from our in-house audiology staff, field staff, or their own audiologists. We offer group and one-on-one 30-minute appointments for those who might have a specific need or a specific request. For instance, how to pair their phone to their app. And we've had great success talking our non-technically minded recipients through accessing Zoom class. As always, if a patient needs immediate support, they can call our phone number 24/7, 365. For professional support, we've transitioned our learning management system to our global platform, the Medell Academy. And the Academy contains our US content as well as information from our global headquarters in Innsbruck, including recorded webinars from experts around the world in Experts Online and more. You'll need a MyMedell account to sign up, so if you haven't already done so, please do. Medell has several resources available on all of our products and accessories to help support you and your hearing implant recipients. Our online resources include our website, professionals blog, consumer blog, audiology online, YouTube troubleshooting videos, and more. And if you haven't already, please log into the Academy to look at the plethora of training resources available. And I encourage you to have the next 5 recipients you see sign up for Medell Mondays. They're so valuable and they save you time. For more information on anything you heard today, please contact your regional Medell team, or you can contact our main office at medell.com or 888 Medell CI. We'd love to hear from you. Thanks for your attention.